let's talk about vitamin D now. We're going to talk about why it's considered an essential nutrient. What is its role with sun exposure? How does the sun exposure activate the vitamin D in the body? How does vitamin D work with calcium? And what some of the food sources of vitamin D are, as well as toxicity levels. So vitamin D is a fat-soluble essential vitamin. Now, when we talk about vitamins, we say that it's something that our body can't make. Well, our body can make it, but we have to have UV light to do it. So it's not made in an active form in our body. Cholesterol is actually the precursor to the active form of vitamin D. And what's interesting about vitamin D is it acts in our body like a hormone, meaning that it tells the body to do something. And what it tells the body to do is to absorb calcium. So there are two types of vitamin D. There's vitamin D2, and this is the type that is used primarily in supplements. Okay? Vitamin D3 is sometimes used in supplements, but it's used to fortify foods, and it's also the form that is found in food. Sunlight causes an inactive form of vitamin D to become vitamin D3, which is the active form. Okay, so vitamins D2 and D3 travel to the liver, and they're converted actually to calcidol. And calcidol then is converted in the kidneys to calcitrol, which is the real active form. So here's a picture. The sun takes the 7-dehydrocholesterol that's in the skin, turns it into calcidol, and then the kidney turns it into calcitrol, which is the active form of vitamin D. So vitamin D can regulate how much calcium is absorbed in the blood by three ways. One, it tells the small intestine how much to absorb. So that works out with phosphorus and calcium. But then it also works with the parathyroid hormone and calcitonin, which is a hormone, to regulate how much calcium is excreted via the kidney. Then we also have the ability to get calcium in our blood through the remodeling or reabsorption of bone. So the parathyroid hormone is a hormone that is responsible for working with the kidneys to decide when to keep calcium and when to excrete calcium. So what does vitamin D do? The main function of vitamin D is to maintain calcium and phosphorus levels in the blood. But vitamin D also works in gene expression, cell growth, neurotransmitter, immune function, and reduction of inflammation. And this is one of the main reasons that vitamin D has been such a hot topic lately, is its role in reduction of inflammation. So again, our vitamin D's functions can affect our immune system, our brain and our nervous system, our skin, our muscles. There's a lot of effect that it has. And we are realizing now the importance it has in reducing certain types of cancer. So the amount of sun exposure is important because the form of vitamin D that is found in our body is the most absorbable form. So we have to look at how we get our vitamin D by the sun. And it varies by our skin color, our age, what time of day it is, where we live on in the earth, how much we are outside, and the season, because the sun is at different angles during different seasons. So not to get too much into the science of it, but keep in mind that since our earth is tilted on its axis, that when we live above or below the equator, the amount of light that we get during the day varies greatly on the season that we're in. So for example, in the northern hemisphere, we get most of our sunlight during the summer, versus in the southern hemisphere, most of the sun comes in their winter solstice. Okay, so let's just talk about some things that inhibit vitamin D status. So inadequate sun. So if you live too far north or too far south during those times, if you have too many articles of clothing on, for example, women who wear covering their body, air pollution can contribute to avoiding it. SPFs over 8 actually do. And then excessive time spent indoors. So if we're working on the computers all the time and we're not outside, we're not getting that vitamin D. We're not getting the UVB ray to convert it. As we age, we convert less vitamin D. If we have darker skin, we convert less vitamin D. If we also don't intake enough of vitamin D, then we can't, if our skin can't compensate for it, then we can be low. Sometimes exclusively breastfed babies, if they're not exposed to the sun, do not get adequate vitamin D. If there are times in your life where people are malabsorbing fat because of liver disease, certain medications, or cystic fibrosis, they don't absorb vitamin D. Also, release of vitamin D stored in subcutaneous fat is very inefficient. So being overweight, we can't get the inactive forms out. Liver disease and kidney disease obviously will affect the activation. So we talked about deficiencies being in dark-skinned people, people with not very much vitamin D in the diet, people who don't get sun, diets that aren't fortified. And what is the disease that they would get? It's actually called osteomalacia or rickets, and that's a bowing or a softening of the bones, which you can see here. So how much is enough? You only need about 600 international units for healthy people, but basically you don't even need to take vitamin D if you're getting enough from the sun, okay? But really, as an example, a cup of milk is about 100, okay? So for kids, if they're getting 4 cups of milk a day, they're doing fine. Now adults, we don't really drink 6 cups of milk. So it's why fish is actually so important for us, because fish really has the best sources of vitamin D. And we want to make sure that we don't get too much. 4,000 international units is high. And the problem with that is it can increase blood calcium levels being absorbed, which actually can contribute to some problems with the kidney. But again, you're not going to get this from the sun. This is going to be from supplements. All right, moving on to magnesium. How does magnesium play a role in bone health? Well, it's interesting. Magnesium actually helps provide some of the rigidity or the strength to bones. Most people in the United States don't get enough magnesium, just as we don't get enough vitamin D or calcium. And the reason being is that when we refine our grains, meaning that it's not a whole grain, we lose 80% of the magnesium. When we put vitamins back onto refined grains, magnesium is not one of the nutrients that's required to put back on. Lots of different deficiencies: irregular heartbeat, muscle pain, disorientation, bone strength, bone development, bone formation. Those are all some problems. Now keep in mind, these minerals all kind of compete for binding sites, so we have to be careful with what other minerals they're taken with, as well as a high fiber diet. And it's interesting, a low protein diet actually may reduce. You need some protein to help that magnesium absorption. You do lose magnesium if you are using a diuretic or have prolonged vomiting or diarrhea. So where do we get it? Whole grains is our very best source, but it's in a wide variety of foods. So fruits and veggies, whole grains, legumes, some dairy is also in some dairy products. So kind of the same types of foods we've been talking about eating. How do we get too much? Again, it's from taking supplements, okay? So a lot of the over-the-counter laxatives and antacids like milk of magnesia, if people are really eating, drinking, and taking too much of that, that can happen. And people with kidney failure. All right, let's talk a little bit about fluoride. So it's interesting that in the early 1900s, dentists noticed that in the southwestern United States that they had very little dental caries, and they had started to fluoridate their water there. And so one of the reasons is that fluoride provides some rigidity and protection against for the tooth enamel. So one of the best ways to get the fluoride in is obviously from fluoridated water. And it's interesting, refrigerator or Brita type of filters, people always worry about this. They don't filter out the fluoride. Okay, so where do we get most of our fluoride? We actually get it from fluoridated water, but we can also get it from shrimp, fish, tea, seaweed. What if you get too much? Again, most of the time it's due, and not to a supplement, but it's due to intaking too much from toothpaste or from fluoride rinses, swallowing those. And that happens more in kids. And so as their adult teeth come in, they get these molted teeth. All right, last few slides, I want to talk a little bit about vitamin K's role in bone health. Well, there's a couple other vitamins. Vitamin C and iron help with vitamin D activity. So those are also involved. Vitamin K actually activates those bone proteins that we looked at, those bone building proteins. And here's a nice summary of micronutrients that function in bone health. All right, I wanted the last bit of the slide is to talk about osteoporosis. Osteoporosis is pretty common, and I want to show you this picture. This is what, remember we talked about trabecular or the spongy bone. You can see that there's a lot of space in between these, but there's some pretty good structure to keep that. Osteoporosis causes very weak or porous bones. 2 million bone fractures occur per year and 300,000 broken hips. It's really becoming a huge impact on our healthcare system. And that's because they don't have a lot of mobility and they need more long-term care. And once that they are admitted to the hospital, there's obviously increased association with mortality, morbidity, and eventually death. And it just shows the impact of osteoporosis. So white, we talked about, and Asian cultures are much more likely to suffer from osteoporosis. Two different types of osteoporosis. We don't really need to go into that. A lot of people are on medications now, bisphosphonates and parathyroid hormone, as well as calcium and hormone replacement therapy. And it just kind of shows how the importance of building healthy bones in the first part of your life is important, because this is where we start to get into osteoporosis. And if you don't build good bones, everybody's going to lose bone after about the age of 30. So those first through 30 years are really important. Okay. So this just shows the difference in the spine, how that varies. And lastly, the DEXA scan, using DEXA to measure the bone density. This is how much mineralization has occurred. So this is how we decide if somebody has osteoporosis. So this T-score is really good to look at, because osteoporosis has a T-score of less or lower than a negative 2.5. Low density is a -1 to -2.5, and normal density is over 1. This talks a little bit about a fracture risk assessment tool, the FRAC, which gives you an idea of how your bones are doing without doing a DEXA scan, since DEXAs are more expensive. So let's talk a little bit about bone health without dairy. You could easily follow a vegan diet and get plenty of calcium. Okay, you just have to consider that the dark green leafy vegetables are really going to have adequate amounts of calcium and vitamin D, but they're not absorbed very well. So what do? Dairy-free options. Milk alternatives now include soy, rice, almond, and coconut milks, and they're all fortified with calcium. Okay? So those are some good choices. So this just gives you a little bit of difference. And again, some of these are even higher in calcium. So having 2 cups a day of soy milk is more than adequate calcium needs for a day. So it gives you a little idea. All right. We talked a little bit about using milk as a good source of calcium, but other milks can also be a good source. Thank you.